In the northeastern area of Virginia lie two broad peninsulas, the Northern Neck and the Middle Peninsula. The area is characterized by rolling farmland, forests, wetlands, and tributaries that empty into the Potomac, Rappahannock, and York rivers. Captain John Smith called this area a place heaven and earth never agreed better to frame man's habitation. Farming, lumber, fishing, recreational industries, and tourism make up the largest share of regional income. 10 counties of this area comprise the Three Rivers Health District, a region that covers more than 2,000 square miles. The Three Rivers Health District is a rural region whose population lacks easy access to medical specialists. This can cause major health care problems.
We have one of the oldest populations in the state of Virginia. About a third of our citizens are 65 and older. We have very few primary care physicians, and in addition, we have very few hospitals. So all of those with chronic conditions or even needing access to a general practitioner must travel great distances to see a doctor.
Having to travel great distances for multiple reasons is associated with delayed care. Delayed health care is associated with disease complications, and disease complications are associated with poor health outcome. People don't do as well.
The healthcare system in the region is fragmented and geographically scattered. Access to timely healthcare information is difficult. The problem is made worse by transportation challenges caused by limited public transportation, the predominance of two-lane roads throughout the region, and the fact that bridge travel is often necessary in the region, which often adds significant travel time.
Many times they don't pursue getting the care that they need due to the transportation requirements, the imposing on a loved one or a caretaker to provide the transportation needed to get them and the time required to get them to where they need to get for the specialty care.
For some people, it's even difficult for them to get to their local physician. Then if you add trying to travel to Richmond or Virginia Beach or Charlottesville, that's an enormous burden on that patient and their family.
But many of these problems can be overcome by a telehealth network, a network that uses electronic communications technology to connect family doctors, specialists, and other members of the healthcare team with underserved patients wherever they may be. The concept of telehealth, or telemedicine, has been around for many years, but it has only recently become an option for this area. The Northern Neck Middle Peninsula Telehealth Network was formed to improve the quality of health care and length of life among the target population, and to give them more access to specialty health services not otherwise available in the area. Paul is 41 years old and lives in Kilmarnock. His physician at Rappahannock General Hospital is Dr. Greg Shivers.
Paul saw me in the office about 3 weeks ago for symptoms of pain in his joints, but he also had some weakness that went along with that, and so to me it was not a very clear picture whether this was arthritis or whether he was having some muscle inflammation. I felt that I had gotten as far as I was comfortable getting in terms of his diagnostic workup, and felt that it would benefit his care if I had a rheumatologist see him. He's limited in terms of transportation, and we have no rheumatologists in our community, so telemedicine was the perfect solution.
Prior to the telemedicine consult, also called an encounter, Dr. Shivers referred Paul to a telehealth specialist for a remote encounter. Dr. Shivers' office then sent the necessary paperwork to the rheumatologist, Dr. Lenore Buckley, at VCU Health Science Center in Richmond. At the time of the appointment, a nurse at the originating site typically will take vital signs and gather other needed data. The nurse will upload the data to the electronic patient record on the secure network server. During an encounter, normally a nurse, nurse practitioner, or the physician will present the patient's history.
Telemedicine services can be provided very efficiently and effectively in today's systems. Nurses can provide the consultation services directly to the physicians at the receiving site. We're not required to invest more physician time on our end doing the presentations. Nurse practitioners are able to utilize their time to help us with this. It's a very effective and efficient system.
At this encounter, Dr. Buckley and Dr. Shivers conduct a thorough examination of Paul's condition to determine a treatment plan.
Your heart rate's about 130.
We can listen to the stethoscope electronically. We can listen to lungs.
We can control the camera at our site, or it can be controlled from the distant site. The picture quality is good, and I think it's certainly adequate for the physician at the consultant site to make an adequate diagnosis.
I have a chance to talk to the person and hear in their own words the pattern of their pain, how long it's been going on, whether they might have had episodes of this before.
So I'm going to have you make a muscle, and he's going to try to see if you can hold that muscle in. He's going to pull against your arm, okay?
Patients seem really comfortable with telemedicine. The camera and the monitor don't seem to be a barrier between the patient and the consulting physician.
You can get very close-up looks at the hand to see if there's joint swelling. You can get a very close-up view of the skin to see if there's rashes that are present. I think for patients who can't get a telemedicine consult, the alternative is no consult. And I'm guessing the alternative is probably no consult for about 90% of patients. I now have more of a relationship with the physicians whose patients I'm seeing, because we'll carry on a conversation, I'll get to see who they are, and I think that's an advantage for the patient.
People can receive timely and appropriate health care, especially specialty health care, even in an area like ours where we do not have these services.
I think the patient ends up enjoying it and felt like they got their story heard. I think the physician and I have a chance to get to know each other and to sort of discuss with the patient there what the right plan is. And so in the end, I think it's a good experience for everybody.
After the encounter, the originating facility will bill the appropriate insurer for a facility fee according to procedures. The specialist bills the consult as normal specialty consultation. The Northern Neck Middle Peninsula Telehealth Network uses a distributed network model in which members can connect to and from any network site.
The distributed network will give us flexibility and versatility as we're contacting the resources we need to provide good patient care, not only meeting major academic medical centers for high-level consultative services, but also linking us to community health centers and mental health services. That will give us a lot of flexibility in the system.
The network enables the local hospitals and healthcare facilities to provide more advanced medical assessments, which increases the patient's confidence in the local facility. The local facility also need not fear the loss of patient revenue to the distant urban medical center.
Once a treatment plan is developed by the specialist, then the primary care physician can continue working with that patient, carrying out that treatment plan, and the patient stays in the community, and the physician is able to keep his patient.
Telemedicine also can make physician retention easier for the rural healthcare facility.
Physicians can often feel isolated in small areas where the medical community is relatively small and doesn't cover a lot of specialties. But with telemedicine, they have that direct access to major academic medical centers and can feel part of the larger medical community.
The Northern Neck Middle Peninsula Telehealth Network also provides continuing education opportunities via video conferencing for healthcare professionals and patients in the area.
They can come to a community room, they can be with their friends, they can be discussing either their health issues, which of course everyone wants the programs on arthritis or cardiovascular disease, and this is a great forum for that.
The success of the Northern Neck Middle Peninsula Telehealth Network can be measured by its enthusiastic support from its members and the opportunities for improving the health of the population in the Three Rivers Health District will only increase. Interested physicians or staff should go to nnmptelemed.org.
My experience using the telemedicine process has been positive. It's good when the patient has been able to receive the care that they need right here.
If we can carry around a cell phone that I can take a picture of someone and transmit it thousands of miles in a matter of minutes, Why can't we integrate that into our healthcare system?
You know, I am so excited about telemedicine. I talk to every group about it. I try to explain to folks who aren't familiar with the concept that this is the new age, especially in rural areas, but I think in any area it's going to be the new age of medicine.